we had another great talk from Scott Katz at Henry Ford. He's a hospitalist who just loves anticoagulation and the periop stuff, and did a great job of running through a lot of current studies or newer studies about this stuff. I'll just highlight a couple things that I found to be interesting as someone who probably doesn't do as much periop as some other hospitalists. But one thing that he pointed out from the 2022 chest guidelines was patients on mechanical valves with AFib. Well, the bridging conversation always comes up. The guidelines say no. However, they also give you some considerations and for patients that are high risk. So basically, any CHADS-VASc risk factors are risk factors that you should consider as patients that are high risk, and those are ones you should consider bridging, which I think we all kind of have moved towards anyway, but it was nice to see that this is being put in like formal guidelines, because this is something that comes up later on in our episodes that we've done so far. And then always fun, DOACs and dialysis, level iteration, as Meredith knows. And the study from Cohen in 2022, one was not particularly helpful, I would think, because they talked about CKD patients and that there was less bleeding in apixaban than warfarin patients, but they didn't use INRs to drive any of the warfarin patients. So I think it's kind of hard to know what to do with that information. And then in general, the shift with patients that have AFib and CKD and meet criteria to be on anticoagulation, there's been this it's taken a while for them to get in any data really to support DOACs, but it seems that the data is moving in that direction. Maybe not quite to the point where it's going to be formal guidelines, but the data does seem to be moving that way, which is helpful, I know, because we all have been on the DOAC train for everything else for a long time. And, those nephrologists, takes them a while to get to places sometimes. So I think the last one I wanted to highlight was, I think it's relevant to people even who don't do periop, more like as a consultant for surgeons or neurologists. So the Reno Extend trial, basically they were looking at patients that are on any sort of anticoagulation that have AFib and then had a stroke. And basically their intervention was, do you change what they're on or do you not change? And the answer is there really wasn't a lot of difference. So changing it probably doesn't really help. And then to note, adding aspirin to whatever they were on increased your bleeding risk. So don't do that. They can say that fairly confidently. So those were kind of the periop anticoagulation related things I wanted to highlight. And I think that we're planning on doing a full episode at some point, so be on the lookout for that.